All right, guys. So today we're going to be reacting to Grey's Anatomy.
Yes, Dr. Bailey's 5 rules. Honestly,
Right.
I've heard of Grey's Anatomy a lot, but I don't know exactly what it entails. So we're going to see that today.
So, as a medical student, most of you have, heard about medical dramas.
Yes.
Medical dramas are what they are. They are dramas. They are nothing real. This is not how the hospital is being run.
It's Hollywood.
That is why it's funny for us, generally. So, this is Grey's Anatomy, one of the most popular medical dramas out there. There are very few. It has 12 seasons, right?
Yeah, 12 seasons, over 12. I think they're still making.
All right.
That's popular.
So today we're going to be reacting to one of his most popular scenes, which is Dr. Bailey's 5 rules for the new interns that came into the
Yeah.
hospitals. So let's see.
That's the Nazi?
I thought the Nazi would be a guy.
I thought the Nazi was...
All right. So first point: medical doctors or medical students don't look this good.
They look too clean.
Exactly.
Too clean.
Exactly. Like we have medical students as classmates, and some of us don't even iron our lab coats.
I'm just telling you, not all that
Exactly.
glitters is gold.
Look at how clean they look,
No.
and they have like every one of them. Like, it's the first day, and they have the same type of clothes.
No, see this. I'm not saying like we're not hygienic. Don't get me wrong, but this is too good to be true.
It's too good to be true.
Nah, it's
exactly.
Hollywood.
Some people buy lab coats that are reaching on the belly. Some buy lab coats that are reaching on the floor.
This one is uniform.
It's
Look at
uniform.
the white collar. Is a lie. It's not like this. So
Exactly.
It's not like this.
Let's move forward.
A Nazi? Maybe it's professional jealousy. Maybe she's brilliant and they call her a Nazi because they're jealous. Maybe she's nice. Let me guess, you're the model.
Oh, I just realized they call her.
Hi, I'm Isabel Stevens, but everyone calls me
Because she
Izzy.
terrorizes.
I have 5 rules. Memorize
All right, 5 rules. Let's go for the 5 rules.
them. Rule number 1, don't bother sucking up. I already hate you. That's not going to change. Trauma.
All right, so I really do understand the rule number 1. They don't like you when you're just coming into the hospital, because medical students are arrogant and they're annoying and they feel like they know everything.
And they always want to ask a lot of questions.
Exactly.
Which is not bad. Which is not bad, guys.
It's bad.
It's not bad. No, see,
It's
it's
bad.
not bad to be inquisitive.
Later
not
in this
bad.
video, I'll tell you why it's bad.
Okay.
Later in this video, I will tell you why it's bad.
Okay, we'll
because
hear
medical
about-
students come in, right, and feel like they know everything. They even try to argue with the doctors.
Oh,
Like,
okay. You
wrong.
mean that entitlement feeling?
Yes, that entitlement feeling. Okay,
get
I read anatomy. I
I
read pharmacology.
understand.
So I know the drug that is going to work
Don't
for
worry,
this.
let me tell you something. If you're that kind of person, you'll be humble very quick.
You will suffer. In fact, they don't
Very
even like you.
quick.
They're not even going to
Nah.
pretend. They don't even allow you go to see the patient. They keep you somewhere.
That's what I said, don't bother sucking up. Don't be nice.
Because they already
don't
hate
like
you.
you already.
All right, next.
Protocol phoneless pagers. Nurses will page you. You answer every page at a run. A run.
Okay. All right. So the second rule, they're talking about the nurses, right? Because
When they page you in.
when you go into the hospital, you're thinking, okay, I'm a doctor and she's just a nurse. Some nurses have had 30 years of experience. Some of them were nurses before you were born.
Some nurses are more important than doctors. Don't look at them like that.
No.
It's a big argument. I'm telling you, some.
No, you can't say some nurses are more important than doctors. Nurses
Okay.
on paper are ranked less than doctors because in school they know less than doctors. But most of these nurses have more experience than
Okay.
than
There
the new
I agree
than the
with
new
that.
than the new
Yeah.
doctors that are just coming in, because you're 20 something years old, you graduated last year. You probably don't even know how to read the ECG well
That's
and
facts,
stuff like that.
though.
You're
That's
just coming in
facts.
to
It's
straight.
true. I take back my comments.
You know better than the nurse. Stuff like that.
It's true. It's true.
Basically, some nurses have more experience on what, especially emergencies, more than the doctors that are coming in,
Yes.
and they will chew you alive in that hospital
They'll
if you try to
finish you.
disrespect some certain
No,
nurses.
you can't come there and try and rank.
Be like,
No,
okay.
it's
But I
not
still
good.
believe doctors are,
Yeah,
ranked to be
I get
higher
what you
than
mean.
nurses. Okay.
That's rule number 2. Your first shift starts now and lasts 48 hours. Your
Exactly
intern.
what I wanted to say. All right, let me allow the rule.
Runs nobody's bottom of the surgical food chain. You run labs, write orders, work every second night until you drop, and don't complain.
That is exactly what I was trying to say. You're coming into, imagine you spending 48 hours on a shift, right? And a medical student that feels entitled comes to disturb you and ask you stupid questions that you're supposed to have read himself. So how are you gonna feel? How are you gonna react to that? You'll be angry at them.
No, I'm just saying medicine is not your day-to-day 6 to 9. But no, it's not like that. 48 hours and running, you are meant to be running with those 48 hours.
Yes. Even now, sometimes they just try to stress us for no reason. Like we have 6 hours classes. Tomorrow we're having a 9-hour class on Saturday.
8 to 3.
It's a
On
Saturday.
Saturday. I
It's
have
supposed to
one
be a
day
weekend. Med school is not for the week.
Just know what you're signing up for.
Exactly. They try to
Know
stress
what
you
you're
so
signing
much
up
so that you quit. And so that at the end of the day they just choose the most like resilient people and all of that. So like they start training you with stupid stress. They trying to break you from the time you enter med school, from the time you become a doctor. What is a 48-hour shift?
What?
The 2 days you're in the hospital.
You're in the hospital sitting, or you might not. Okay, let me not say sitting.
Yeah,
because
you have a lot of work.
You have something to do.
All right, let's see what the third rule is.
On-call rooms. Attendings hog them, sleep when you can, where you can. Which brings me to rule number 3. If I'm sleeping, don't wake me unless you're...
If I'm sleeping,
Don't wake me
up.
Like, no, I can relate
Even
to
for
that.
me,
No.
if I'm sleeping after going to school for 6 hours, right? I'm coming back and trying to get my life together.
Nah.
I'm trying to get a nap, and someone come wakes me so something.
For just something
you and I
meaningless,
have,
no.
you and I have a problem.
It's not going to work like that.
Of
No,
course.
you can't do that.
But it's all right. It's all right. So if I'm sleeping, don't wake me.
I can relate to her. Sleep is vital. 48 hours, no, you can't just wake me for anything.
If you go to the hospital, sometimes you see some nurses sleeping in some certain rooms, like because they are tired. Come on.
You can, of course.
It's not easy, and sometimes like when it's not a busy day, like for Dagestan here, I know on Mondays it's not very busy, so sometimes they you go to the hospital for a whole Monday and you see like just 5 patients,
Yeah.
So in some departments.
Yeah, it depends. It's true. It
All right.
actually depends.
So let's see the next rule.
The patient is actually dying. Rule number 4, the dying patient better not be dead when I get there. Not only will you have killed someone, you would have woke me for no good reason. You clear?
All right. So about killing patients is one of the things that we're really scared of. Well, because we had this simulation center.
Yes.
We went to the simulation center and we killed all our patients.
You killed no, of course we killed 2. I'm not lying. I felt emotional because the guy, we couldn't help him.
It was literally a computer.
Yeah, it was a computer, but it was sad because you lose somebody.
Of course, you're gonna kill people. That is why they don't allow us work unsupervised.
Exactly. You need to know your things. You need to know.
And these are real human beings. Like
Yes.
imagine if someone kills your dad because he forgot to read his books.
Exactly. How do you explain?
Like how are you gonna
That's
like?
why medicine is such an important subject. You have a person's life.
But we use life sometimes to practice. That's why it's called practicing medicine. Don't leave me. It's a dad joke.
No, please, I'm leaving you. Next scene, please.
All right.
Yes.
You said 5 rules, that was only 4.
Rule number 5, when I move, you move.
I hate this. When you go to the hospital and
follow them.
our general surgery teacher used to do this to us when she takes us like to
You
about
must
20
follow them wherever,
20 patients.
You are behind them.
And you are tired.
Tailing after them.
And then
don't
you
know where they are going.
stand for 2 hours. Guys, I didn't sign up to be a military man. I'm not in the military. I'm not a
It's the
soldier.
stairs. You guys, fun fact, as a medical student, you must be fit. It doesn't matter. You have to learn how to walk fast. You have to learn how to climb stairs.
Exactly.
You have to learn how to be quick. You can't be walking slow. No, I'm not lying.
All right. So, but to conclude this is drama. It doesn't happen like this in real hospitals.
True, though. Hollywood.
All right, it's Hollywood.
is-
They're always trying to entertain. It's entertainment,
it's
right?
entertainment.
They want you to watch. It
Yes.
doesn't work like this.
Yes,
Sometimes.
they want to make doctors look all no, it's
Cool
not
or
like,
stuff like this.
It's not like that at all.
All right. So, thank you guys for watching today's reaction video.
Yes,
If you're interested in more reaction videos, please
just give us the topics.
yeah,
below
no,
in
give
the
us the
comments.
movie that you like or the series you
Yeah.
want to, like The Good Doctor or The Resident or anyone.
Anyone.
And then I would really
Really
advise you to start watching medical drama.
Yeah, it's true.
Because
No, I
they
would like,
even
I
though
feel
it's
like I'll start
Hollywood,
Grey's
they show you a
Anatomy.
little bit
Of
of what is
what's
going on in the
going,
hospital.
what will happen. You
All right, so
understand?
thank you guys a lot. Which of these rules did you like the most or did you hate the most?
Yes, please tell us
comment
in the
below,
comments.
and I'll see you guys next time.
Before we go, please, if any of you know like this woman, please, like the actress, please tell me her name because she
It's written
is
here
funny.
literally, Dr. Bailey.
I mean the actress' real name.
Oh, all right.
So thank you guys. Just
All
tell
right.
us what you think.
All
Okay.
right, bye bye. Oh, I'm supposed to stop. Oh Lord.